Hi, I'm Steve Rowe, Executive Director. Today is Wednesday, August 11th. We said 4 weeks ago that we weren't going to have to, or that we weren't planning to talk about COVID anymore with these weekly updates and how quickly things have changed with the Delta variant and the increasing activity within Johnson County recently, and Johnson County Public Health's change in recommendations. We did make the change here at Oak Knoll as of last Friday to go back to encouraging all of our residents to wear masks indoors whenever you're in the common areas. Thank you for all of you who are doing that. You should always see staff in the common areas and even working in your apartments be masked. The only time that we as staff are not wearing masks is if we're actually sitting in our office by ourselves. But it's just kind of where we are right now. Hopefully this stage won't last too long, but again, we just will continue to monitor and do the necessary actions to try to keep people as safe as possible. So thanks to all of you who are helping with that. Did receive several comments from people after we made that change that they feel that residents are feeling more safe since we did that. So hopefully that's the last of the changes, but I'm sure it won't be. Over the last week or so, we have finally had our Department of Inspections and Appeals survey. That is supposed to happen on an annual basis, and it's a surprise inspection, and theoretically happens every 11 to 15 months. The last time that our health center had been inspected by the state surveyors was October of 2019. So we were going on probably like 21 months, something like that. The state surveyors were way behind schedule because of all of the COVID activity and infection control surveys that they were doing, and a requirement that if a community had an outbreak within their nursing home, that the state surveyors had to go into that community and kind of assess what was going on and try to keep people safe. Fortunately, we didn't experience any of those type of surveys. Our residents have been safe, and again have only had one positive case within our residence, and that was somebody who had been vaccinated 3 months prior. But the surveyors were here. They came a week ago Monday and spent 4 days in our health center. That was longer than normal already. Typically they spend about 3.5 days and then it's like check out. They weren't finished with their work after spending 4 days last week, and so they came back Monday and actually didn't leave until yesterday around noon, actually around 2 o'clock in the afternoon. We don't have the results of that survey yet. They did identify a few concerns that were, in my opinion, primarily paperwork concerns, things documented on care plans. So we're hopeful that the survey results are good. I don't think that they will be as good as they were in October 2019 when we received 0 deficiencies, but I also don't think that they discovered anything that was all that alarming. So as soon as we get the report, we will have 10 days to respond to it, and whatever it says, I know that our staff in the health center has worked really hard to keep our residents safe through the pandemic. It's frustrating that effort and the safety of our residents was not acknowledged in any way by the surveyors as they left our building. It's just the system. We should not expect to get positive strokes from regulators. And you try to remind yourself of that. That is not their job. We need to get positive strokes from ourselves. from ourselves and from families, and we do get lots of positive reinforcement. The regulator's job is to come in and to make sure that things are running the way that they are supposed to. So it is disappointing that was not acknowledged, but we will get past that, and whatever the report says, we'll address whatever concerns there are, and we will move forward, and the care that we are providing to our residents will continue to be absolutely top quality care. So that's enough about the survey process. Last couple of things that I want to talk about are thank you to all of you who participated in Retha Haas's 15-year anniversary celebration yesterday. It was a really nice event. Thanks for coming if you were able to be there, and if you weren't able to be there, please acknowledge Retha in some way as you have the opportunity. Retha has been just a fantastic employee and addition to the Oak Knoll staff 15 years ago. She is a family member here and just does a phenomenal job as our Director of Resident Relations. So thank you to Retha. And finally, this morning, I just want to share a little bit about our managers meeting that we just had this morning. We are taking turns through our managers team, each leading a meeting, and today was Laura O'Connor's turn. Laura is our wellness director and has been with us for 21 years. Laura has incredible relationships with so many of you, and she shared this morning with our manager team all of the positive things that she hears as she leads exercise classes or works with people in the exercise room. It's a different environment, and people are maybe more likely to share with Laura some of the things that are on their minds than they would with others. And that's a testament to Laura and her relationship building skills and creating a safe environment where people can just talk. But Laura led us through a session on gratitude. And we have so much to be thankful for. There is an awful lot of good that happens within this community. We've got a tremendous leadership and management team that is committed to you and committed to each other and to their staff. People have worked really, really hard over the last 18 months to keep you safe. They worked really hard prior to the pandemic to offer the best quality of life that we could for you who have chosen to make Oak Knoll your home. Through the course of this meeting earlier this morning, Laura had recruited a lot of you as our residents to come in and share a word of gratitude and thanks and humor with our management team. And for those of you who had the opportunity to participate this morning, I just want to say thank you for that, for sharing your thoughts, for sharing your tears. This is more than just a job for all of us. It's really a special place. And one of the things that I wrote down as something that I am grateful for is the opportunity to come to a job and do something that I enjoy every day, something that I am pretty good at, and something that it truly is appreciated by our residents. So thank you. Over the next couple of days, I will be spending time with my wife. Another thing that I am incredibly grateful for, April and I will be celebrating our 34-year anniversary this weekend, and she and I are going to take a couple days off and go visit our daughter in Peoria. So if you watch this video on Wednesday, I will be gone Thursday and Friday this week and be back ready to go again on Monday. So hope all of you are well. We will see you next week. Take care.